So Kate, what is infertility? How do you define infertility?
Well, the official kind of, I guess, explanation is it's when a couple who are having regular sexual intercourse after 12 months have not been able to conceive.
Yeah.
So that's the official definition of what it is. But obviously there's more to it than that, with the different aspects of whether it be male or female or unexplained infertility.
Yeah, absolutely. And I guess for lots of people, waiting 12 months to investigate their infertility is an issue.
Yeah, absolutely. I mean, not only, I think, once you decide that you want to have a baby, you want to have a baby yesterday, not in 2 months' time or 3 months or 4 months or however long it might take, but also age really impacts on your ability to conceive as well. And we know that couples are leaving trying to conceive until later in life for various different reasons. And therefore, age can impact on their ability to conceive once they do decide that they want to start a family.
Yeah, and is that true? That's true for men and women, I think, isn't it? That, age tends to impact fertility levels.
Yeah, so I think for men, we hear, don't we, all the time about men being able to conceive in their 80s and their 90s, and of course they can. However, the sperm health is not as good as when they were in their 30s, 20s, 30s, and certainly by the age of about 45, sperm health does start to decline. So it might mean that it's more difficult to conceive, and there are more male factor issues.
Yeah. And do you find often then that when there's an infertility issue, it's a combination of male and female factors? Yeah,
it absolutely can be. I mean, certainly male and female, it's half of the problem. So often people assume that infertility is more common in women, but actually it's the same. And about 25% of couples struggle with what we call unexplained infertility, where we've not been able to find a reason for their infertility.
Which I imagine is incredibly frustrating.
It's really frustrating, because I think with anybody, when you want to have some blood tests done, for example, you want to be able to find a reason for the problem. And then when you have blood tests and you have other tests done and there's no reason found, that causes a great deal of frustration. But I think there's also an element of the fact that maybe we just don't have the technology yet to fully understand and fully appreciate all the reasons why somebody might be struggling to conceive.
Yeah. And so what kind of advice do you generally give people who are trying to conceive? What are the how do you give yourself the best chance of conceiving? Yeah,
so I think there's lots of different factors, and I always start off with knowing for somebody to understand their menstrual cycle. So for women to understand when they're ovulating and their fertile window. And I think that's really useful, especially with somebody who might have PCOS, where they've got very long cycles. They don't really know when they're ovulating. Yeah. And so that's really important to have that awareness. And that tends to be one of the first things I talk about. And then I go on to talk about lifestyle, because we know that lifestyle really matters when it comes to fertility, both for men and women. Yeah. So having a good diet, not smoking, not taking drugs. Yeah, absolutely not smoking. Having, good exercise, ideally, if possible, having a normal body weight, but we know that's not always easy. So it's those lifestyle factors that are really important and do play a big part in your kind of optimization of your reproductive health.
Yeah, and I suppose all those same lifestyle factors actually prepare, in the woman's case, the body for pregnancy as well. You want to be as strong as you can be for pregnancy.
Yeah, absolutely. You want to be starting taking your folic acid and your vitamin D and, making sure that you're as healthy and in tip-top condition as possible.
Yeah, brilliant. And how much of a role do investigations play? I mean, for example, blood tests, how much of a role do they play in investigating some infertility?
Yeah, well, I personally think a really big role. And one of the common questions I get from women is, what point should I start doing some investigation? And I think you can never be too early. There's never a too early time to start if you choose to do some blood tests. Yeah. And just some simple blood tests can look at the hormonal health, can just check your thyroid, just make sure that things are exactly how they should be to optimize fertility. And I think there's no time too early.
Yeah, and I mean, with the blood tests, there's, I guess, particular times to test, and when it's best to test for ovulation, for example, or other factors. What would you say about that? Yeah,
so ideally we would do a number of blood tests, so particularly your female sex hormones in the first part of the cycle, so days 1 to 3 ideally, and then progesterone we would do. Well, it's called day 21 progesterone, which is so misleading. So day 21 of a 28-day cycle, but as women often have shorter or longer cycles, then ideally it needs to be 7 days before the next period. But clearly, as women don't carry crystal balls around with them, then that can be difficult to know exactly when. But just timing it so that you're mid-luteal phase, so mid the phase from ovulation to the next period.
Brilliant. Excellent. And what about seeing a specialist in fertility? When's a good time to do that? When would you suggest people start getting advice?
So there are quite strict guidelines, guidelines that say that you have to be trying for 12 months if you're under the age of 35 before you can be referred to a fertility specialist. Or if you're over the age of 35, then it's 6 months. But on top of that, there is local policy from wherever you are in the country. And sometimes I see that it could be 2 years that a couple have to try to conceive before they can be referred. Then you add to that the waiting list once they have been referred, and the whole process can take a very long time.
Yeah, which is sometimes very stressful for people who, as you mentioned earlier, sort of fertility sometimes is time critical.
Absolutely. Absolutely.
Yeah. Sorry, I'm just gonna. Can you edit me out? Okay. And what about people going through IVF? There is blood tests that they need really in preparation for the treatment. What kind of things do they need to be thinking about?
So if you're going through IVF, then your fertility clinic will advise you on all the blood tests that you need. And those can be female sex hormones. There might also be some HIV and other infection screening. So there's often quite a long list. And so that they can access all of those through one-day tests.
So I suppose a topic partly related to infertility, or certainly for some women, is PCOS or polycystic ovarian syndrome. What exactly is it? And, how would a woman know that she's got it?
Really good question, because a lot of women go undiagnosed, sadly. So PCOS is a complex hormonal condition that is often associated with cysts on the ovaries. Cysts actually being a bit of a odd name because actually they're just follicles, but we commonly call them cysts. And this can impact a woman in multiple ways. She might have symptoms of PCOS. So those can be having excess bodily hair where women wouldn't really want it. It can be acne, thinning of hair on the scalp, carrying extra weight, but not all women with PCOS will have issues with weight, and then not ovulating regularly. So some women with PCOS may only ovulate 2 or 3 times a year, for example. So if you're trying to conceive, that can be a real issue. And commonly women with PCOS will have lengthy cycles, but again, not all. Some women can have very normal cycles, but still have PCOS.
Yeah, and you touched upon there about how difficult it is to diagnose. And I guess partly that's the variability in symptoms. It makes it difficult to pick up sometimes. But I'm aware that there are criteria.
The Rotterdam criteria.
Exactly. Yeah. So what are they, and how would a woman get diagnosed? I suppose is my question.
Yeah. So there's 3 criteria, and to have a diagnosis, you have to have 2 of those. So one is that you have irregular cycles. But again, like I said, you don't necessarily have to have PCOS. The other is that you have cysts seen on the ovaries, or more recently, we're now able to check a hormone called anti-Mullerian hormone, or AMH. And if that's elevated, then that can be used instead of a scan. And the third one is that you have raised testosterone levels, or you have symptoms of raised testosterone. So as I mentioned, the typical acne, excess bodily hair, oily skin, that type of thing.
Yeah. And I always think it's interesting that those criteria, you say you need 2 of them out of 3. So you can be diagnosed with polycystic ovarian syndrome without actually having cysts on the ovary.
Absolutely.
Which is, I think it's confusing. Yeah.
It's really confusing. And I sometimes see that sadly women are given a diagnosis that they don't have PCOS purely on the fact that they've had a scan and they've not seen it, cysts on the scan. But however, they've not looked any further to see whether or not they have. So it's important to be assessed on by those 3 criteria.
Yeah, to make sure the hormone levels and everything are as they should be.
Yeah.
And would you? So what advice would you give to women who are, for example, struggling to reach a diagnosis? Would you say they just need to keep pushing, or?
Yes, I think it's really important to keep going back to your doctor, or get as empowered on your own health as you possibly can. And luckily these days, as we know, here at One Day Test, we offer a whole range of blood testing. So someone can get really knowledgeable and empowered on their own health by getting some blood testing done to help them get a diagnosis. And I'm really passionate about helping women self-advocate effectively. And that is one way that you can then take that information to your doctor and say, right, this is what I found out so far about my health. How can you help me? Yeah,
exactly. And I know for lots of women are diagnosed with PCOS, it makes them very anxious about their chance of getting pregnant in the future, and the impact on fertility. what are the odds on pregnancy with PCOS, and is it possible to get pregnant with PCOS?
It absolutely is possible to get pregnant with PCOS, and actually many women, I'd say majority of women who want to conceive with PCOS will go on to have a baby, but they just might need some help. So once they're referred to a specialist, they're able to get ovulation induction medications if they need that. So that's either Clomid or Letrozole to help induce an ovulation. Very few women actually need IVF, and that's a bit of a misnomer, but very few people need IVF. You just need to be ovulating regularly. And then there is medication called metformin, which traditionally was given to individuals with diabetes, but it helps with the insulin resistance, which is part of PCOS and one of the reasons why the hormones are kind of all a bit chaotic.
Yeah. And so I suppose that's very reassuring for most women to hear that actually odds on pregnancy are very good.
Absolutely. Yeah.
So just a bit more on the sort of blood testing side of PCOS diagnosis. Which blood tests specifically should women be looking for?
So there's a range of tests that we would consider. I think it's important to look at the full hormone profile. So estradiol, LH and FSH, but also testosterone, because that's one of the biomarkers that we're looking for to help with the diagnosis. And there's also something called sex hormone binding globulin, which is looked at with testosterone. And again, that is quite useful.
Okay, so there's quite a combination of tests you need to look at really to get the diagnosis.
Yes. Yeah. And then if you want to go a bit further and consider the long-term impact of PCOS, then you can look at cholesterol levels, lipids. You can look at how healthy you are, thinking about cardiovascular health as well.
Yeah, and I suppose the blood sugar impact as well on PCOS is something worth thinking about.
Yes,
as well.
Absolutely. So we can do a test called HbA1c, but actually a glucose tolerance test is, if required, is also really valuable. And people who are diagnosed with PCOS, it's generally recommended that they have either a HbA1c or a glucose tolerance test on an annual basis.
So Kate, what services have we got one-day tests to help women with their PCOS diagnosis or their infertility journey?
So with regards to PCOS, we have a range of blood tests, and we have the ultimate PCOS test, which looks at insulin resistance, so checks for diabetes or pre-diabetic. It looks at our full hormone health and our lipids, cardiovascular health. So it's 25 biomarkers, so 25 blood tests.
Pretty comprehensive,
so lots there. So you can really get a good understanding of your PCOS health. And it is recommended really that is checked on an annual basis.
Okay, great. And obviously you are running our fertility service to offer advice to ladies who are looking for help.
That's right. So the fertility service might not be just trying to conceive. It might be that you want to get some advice on PCOS as well. So we offer both the fertility service and PCOS service for anyone that is wanting to get advice and get empowered on their fertility health or their PCOS health.
What can people expect when they come to see you and your colleagues?
Yeah, so we have a 30-minute consultation, and prior to the consultation, the patient will fill out a questionnaire, which is then really useful for us to be able to understand a little bit more about their past medical history, any medications they're on, whether they've actually had a fertility journey or whether they've been diagnosed with PCOS. So there can be quite a lot of information there, and that can help inform our consultation. So we will be very much advising them on how to manage their condition, whether it be fertility or PCOS, how lifestyle can impact and improvements that they might be able to make, any supplements that could be beneficial to support their general health, and then give them guidance on next steps. So whether it's now time to go and speak to their doctor, ask for a referral or whatever, or it might be that we need some more blood tests in which we can arrange those blood tests through one-day tests.